In this video, I am going to explain the overview of Nurse Associate OSCE. Associate OSCE is one of the easiest OSCE presentation amongst all the field, and this is the reason why. Watch this video to the end as I explain to you what to expect on your OSCE day as a nurse associate. You are going to get 10 stations. On your OSCE day, you are expected to get these 3 fused stations together, which is assessment, implementation, and evaluation. That is called the AI. You are also going to get 5 clinical skill stations on your OSCE day. So the 5 clinical stations, in addition to the 3 fused stations, making 8 stations. And then you are going to be getting the professional value and evidence-based practice as well, so that you get 10 stations in total. Now let's expatiate on what to expect on each of these stations as I explained. You are getting assessment station. On your assessment station, you will be given a scenario, and in that scenario, you are supposed to go and check the patient's vital signs using the A to E approach. So on assessment station, you are conducting an A to E assessment on a newly admitted patient that has been admitted to your ward. You are going to conduct airway, breathing, circulation, disability, exposure assessment on this patient. That is going to be your assessment station. So in airway, you have to check the patency, and if there is no obstruction, you have to check that as well for the patient. You are also going to check for breathing, and breathing comprises of the respiration of the patient, the oxygen saturation of the patient, and you go to circulation. In circulation, you are going to check the pulse of your patient, the blood pressure, capillary refill, pallor, and perfusion. And then you go to disability. In disability, you are using the ACPVU. You are checking the alertness of your patient. If your patient is confused or unresponsive, you are checking for pain. Next thing is exposure. And in exposure, you are going to check the temperature of the patient using the infrared thermometer. This is how the A to E assessment is going to look like. Just like the normal vital signs, you are going to check and explain everything you are doing to the patient. So that is what to expect in your assessment station. The next station is implementation. Implementation station, you are going to administer tablets to the patient. You have admitted the patient to your ward. Now it's up to you to serve the medication that was prescribed to the patient. In implementation station, there are 3 things that you are going to do. The first one you are going to do is to read the whole prescription and identify the medication that is due your time to serve for your patient. Read through the prescription and identify the medications that you are supposed to serve. Dispense the medication from the drug trolley and serve the medication to the patient. The next thing that you are going to expect is evaluation. In evaluation, you are handing over the care to the doctor in a different unit or a different department. You can either hand over to your colleague in the same ward. In evaluation, all you are going to be doing is to make sure that you have every information about the patient. You are going to be given the assessment station documentation, the implementation station documentation as well. Because it's fused together, everything that you've done for the patient from assessment station is what you are going to be highlighting in evaluation. The acronym for evaluation handover is the SBAR, Situation, Background, Assessment, and then Recommendation. You are using this SBAR to hand over the patient's care. In situation, you are introducing yourself and handing over the patient details, biodata of the patient, mention the diagnosis, everything else that relates to the patient, and you state the reason for handing over. And then you do the background, the overview of the assessment. During your assessment station, you're given an overview. So you're reading the overview to the person who is taking up. That gives the information about the patient. So you are going to get like the presenting complaints, medications that they are on. You are going to get the social history, allergies, and drug history. So you hand over to the person taking up. And then you go to assessment. In assessment, you are going to highlight your previous vital signs and compare with the current vital signs and state any deviation there is. Draw the attention of the person taking up so that they can monitor your patient. Now you go to recommendation. In recommendation, every referral that is needed for the patient is highlighted here. So the referrals that you are supposed to do for the patient, you are supposed to highlight it here in recommendation stage. Now, let's go to the clinical skills. You are having 5 clinical skills. The first one is administration of inhaled medication. The second one is pain assessment. The third one, pressure area assessment. Then you have fluid balance. And then the last one is hospital admission. These 5 clinical skills is exactly what you are going to be expected. You have these 5 clinical skills and you are expected to get exactly that during your OSCE. So in administration of inhaled medication, you are administering inhaled medication, which is due your time to your patient. Pain assessment, you are using PQRST to assess the level of the patient's pain and take appropriate appropriate measures for the patient. Pressure area assessment entails checking the areas and signs that are prone to get pressure sores and also highlights the Braden scale score for the patient. You go to fluid balance, that is the intake and output, and you deal with the intake and output total balance. Now, the last thing is the hospital admission. In hospital admission, you are going to be given a questionnaire that you are going to read out or confirm some details from your patient to admit them to the ward. So there are some questions printed to you so that you ask to plan better care for the patient. You need to know if the patient needs assistance with eating and drinking, personal hygiene. So you are going to be given a questionnaire and you ask and fill the details and sign. That is your clinical skills. And then you get professional value 1 evidence-based practice. Professional values is very simple. What are you supposed to do for a particular situation? If there is a situation of confidentiality, what are you going to do about it? So you have to write 5 points for your professional value. With the professional value, you will be given 1 scenario, and the scenario can be like confidentiality. So what is your professional value against that concern of confidentiality? You write 5 points. So as your professional value, if there is any concern about confidentiality, how are you going to deal with it? Reporting to your manager, acknowledging that this is your right to keep the patient details confidential. And then evidence-based practice, you're going to be given a scenario, and in that scenario, you'll be given an article that backs the scenario. So it's more like if, let's say, some school of thought are saying you're supposed to take ibuprofen for pain instead of paracetamol, the article or the research that shows that this is real or this is true, being the research findings, will be given to you. So you're going to fish out 5 points from that to form your whole presentation. That is how you're going to get the OSCE station as a nurse associate. So as you prepare, put it at the back of your mind. You are expecting 10 stations. The 3 stations are the AI, which is the assessment, implementation, and evaluation. You are admitting a patient, giving the tablets to them, and then handing over the patient's care to somebody else. And then you have 5 clinical skills, which has a performing station and a silent station as well. So 5 clinical skills, you are getting pressure area assessment, which is a silent station. Fluid balance is a silent station. And then you get the performing stations, which is the pain assessment, the administration of inhaled medication, and the last one is the hospital admission station. These are the 5 clinical skills you are going to expect during your OSCE, making it 8 stations, and then you get the last 2, which is 1 professional value, 1 evidence-based practice. This is all you need to know about your OSCE as you prepare for your OSCE as a nurse associate. Stay tuned for the next couple of videos as I dive into the stations for you to know what to actually do on each station. Subscribe to this channel, leave comments on what to expect or what you want me to do or clarify for you, and leave a like, share to your OSCE buddies, and let's pass together. Thank you.